Okay, let's start with this. That's easy, okay. Look at this. How to protect yourself against the coronavirus. How to protect yourself against the coronavirus. You know, cómo protegerse a ti mismo en contra del coronavirus. Hemos visto en los news, en la televisión, en la radio, hemos escuchado, lo llaman COVID-19. ¿Por qué es la razón que lo llaman COVID-19? Porque esto está en inglés. C-O, significa corona. And D, virus. Y la letra D es en inglés que dice diseases, enfermedades. Y 19 es el año en que se produjo el coronavirus. ¿Ok? Ok, let's continue.
Coronavirus disease 2019, abbreviated as COVID-19, is a respiratory illness that spreads from person to person.
Okay, that's the, I will explain, right? Coronavirus disease. That's the correct name of the COVID-19. Por ahí dice corona, de co, virus, de B, y disease, de D. 2019 es la fecha, right? Let's continue.
Person. It's caused by a new virus that was first detected in China and has now been detected around the world, including the United States.
Okay, in this case, look at the video. The coronavirus starts in China, etc. And then it spreads around the world y luego se esparció por todo el mundo, right?
The World Health Organization, the U.S. Centers for Disease Control and Prevention, and other public health authorities are still learning about this virus and are working hard to control its spread and make sure our communities are prepared.
Okay, there is an organization against the coronavirus. Hay una organización en contra del coronavirus. ¿Por qué nuestro presidente nos da la fecha para salir? ¿Por qué nuestro presidente nos dice qué tenemos que hacer? Porque él consulta con the organization of the, against the coronavirus. Okay? In order to prevent the vaccination, all.
You can help protect yourself and those around you from getting and spreading respiratory illnesses like COVID-19 by taking some simple precautions. One of the most effective ways to prevent the spread of germs is to wash your hands often. Make sure to scrub with soap for at least 20 seconds. If soap and water.
Okay, the coronavirus, you have to prevent washing your hands, right? That's the first part. You have to prevent washing your hands. If soap and water are not available, use the alcohol-based hand sanitizer that contains at least 60% of alcohol. Okay? Usted tiene que utilizar, si no hay jabón y agua, utilizar alcohol, pero tiene que tener un 60%. Hay farmacias que, drugstores que venden a 96%. Eso es mucho, ¿ah? Eso es mucho, it's high. Be careful with this.
Water are not available. Use an alcohol-based hand sanitizer that contains at least 60% alcohol. Hand washing isn't the only preventative measure you should take to reduce the spread of germs. It's also...
Okay, hand washing isn't the only preventive measure you should take to reduce the spread of germs. Dice que el lavado de manos no solamente es la prevención para bajar y reducir la expansión de este germen.
Also important too. Avoid close contact with people who are sick and keep at least 6 feet between yourself and anyone who is coughing or...
Okay, that is important. This is the social distance. Okay, you have to prevent in order to don't close to other people. Okay, don't close to other people. No estar muy cerca de la otra persona. This avoid close contact with people who are sick. Usted tiene que ponerse en la mente cuando sale de su casa que todos tienen coronavirus. ¿Ya? Que todos tienen el coronavirus. Entonces, you have to prevent. Don't close to other people, especially to old people, especially your grandmother, your grandfather. Okay? No tiene que estar en contacto, no tiene que acercarse mucho a sus abuelos, a sus abuelitas, a las personas mayores. Usted puede ser asintomático, ¿ok? Be careful with this. Usted no puede tener ningún síntoma porque usted es young people, es joven, right?
Sneezing. Avoid touching your eyes, nose, and mouth.
Okay, that part is important. Look at this. Okay. Avoid touching your eyes, nose, and mouth. Usan ustedes gloves, ¿no? a mask too. But the important is not touch your eyes, not touch your nose, not touch your mouth. That's important, okay? Be careful with this. You use the mask and cover your eyes with the glasses or protect your eyes in order that you prevent this. Van a empezar a salir ya a la calle algunos de ustedes, ¿no? Entonces tienen que protegerse usando las máscaras, usando un lente especial, ¿ok? Let's continue.
Avoid touching your eyes, nose, and mouth. Cover your cough or sneeze with a tissue, and immediately throw the tissue in the trash.
Okay, that is important, okay? If you feel that you around your nose, que sientes que tienes congestión nasal, don't touch all around all. No toques todo. You have to prevent this. You have to cover your nose with a handkerchief also clean, but not touch all the parts, okay? In order to prevent.
If you don't have a tissue, cough or sneeze into a bent elbow instead. Never cough.
That's important. When you sneeze, you cover the sneeze with your hands or with your arm, okay? Or you cough, you cover, okay? Si tú toses, si tú estornudas, te tienes que cubrir.
Cough or sneeze into your hands or into the air. Clean frequently touched objects and surfaces daily.
That's important. You have to clean frequently touched objects and surfaces daily, such as. Tienes que limpiar frecuentemente todos los objetos que ingresan a tu casa o que compras también. Okay, the tables,
countertops, doorknobs, light switches, and cabinet handles with
okay.
household cleaners and disinfectants.
Maybe you can sound very crazy, ¿no? Puede sonar muy loco, ¿no? Tienes que limpiar los interruptores, las manijas de las puertas, todo lo que entre en contacto diario en tu casa.
Household cleaners and disinfectants. Stay home if you're sick. If you have a fever, cough, and difficulty breathing, seek medical care, but be sure to call in advance. Your medical provider will be able to direct you to the appropriate facility in your area. Lastly, follow the CDC's recommendations for using a face mask. Face masks are not recommended for use by the general public. Rather,
okay, this is important. The face masks are not recommended to use by the general public. It depends on. Si la máscara de protección está bien hecha, sí puedes usarlo. Pero si sabes realmente que esa máscara no te va a ayudar, y si es que está hecha de una tela que va a permitir fluidos, es mejor que no la uses y es mejor que uses una que te proteja.
By the general public. Rather, face masks should be worn by people who show symptoms of COVID-19.
Okay, that's important. You have to wear face mask, if you have fever or sneezing or coughing or difficult breathing. Okay, si tú sientes fiebre, sneezing, o sea, estornudo, coughing, si toses, difficult breathing, es cuando no puedes respirar. Okay, you have to be careful with this, okay?
To help prevent spreading the disease to others. Face masks should also be worn by people taking care of someone with COVID-19, such as loved ones or healthcare workers. While there is currently no vaccine to prevent COVID-19, staying up to date on your other vaccinations can help you stay healthy and protected against other respiratory infections.
Okay, that's important. There are some vaccinations. Hay algunas vacunas contra la influencia que han debido de vacunarse con anticipación. Si no se han vacunado, ya cuando pase todo esto, tienen que ir a la posta más cerca, una de su casa, y vacunarse contra la influencia. That's good. This is good to prevent.
Such as a seasonal flu or pneumonia. If you haven't already, ask your healthcare provider about which vaccinations are recommended for you. If you have any questions about how to best protect yourself against respiratory illnesses like COVID-19, talk to your healthcare provider.
Okay, that's good. So if you don't know too much about this, you have to read and you have to ask for some questions, okay? So that's important.